Today we are going to discuss how simple acupressure techniques based on TCM principles can be an effective treatment strategy for anxiety in children. These same techniques can also be useful in the treatment of similar emotional effects of depression and fear that may also be present with your child. Childhood depression and anxiety is far more common than formerly believed or acknowledged. According to the National Institute of Health, as many as 26% of children experience episodes of anxiety during childhood. Also, as many as 6% experience social phobias, both of which can be debilitating, lead to perceived behavioral issues, and affect a child's psychological development. So what are common triggers of these anxious, depressed, or fearful episodes? A large part of our child's social interaction comes from school settings, which can include stress factors associated with bullying, social formations, and academic expectations. Childhood is also fraught with new and scary social situations that a child has never experienced before. Struggles and strife at home, as well as coping with family illness, can be an important factor, and if the child has had any traumatic experiences, this can certainly be carried with them. While we are all human and aren't immune to psychological responses due to stress factors, it is key to recognize what your child's common triggers may be. These anxieties, phobias, and fears in children that develop can often be overlooked. This leads to unusual behavioral patterns in your child and can many times be explained away as simply a child misbehaving. Fortunately, there are simple TCM and acupuncture strategies to help with your child's anxiety levels. Clinical research shows that acupuncture and acupressure aids in activating the parasympathetic nervous system, which is our rest and digest, and activates self-healing. Children can benefit from simple ear acupressure utilizing ear seeds. These come in handy for an on-the-go lifestyle. They're less frightening than needles, and they're a great alternative to needles if your child is frightened or needle sensitive. Studies show that auricular acupressure applied for 48 hours can reduce stress in your child. Ear seeds are small seeds or metal balls attached to the ear with a Band-Aid-like clear or flesh-colored adhesive that stimulates certain pressure points based on Chinese medical theories. The next time you or your child see your acupuncturist or TCM practitioner, have them demonstrate and show you where and how to place the ear seeds on 3 major ear points. These points are Shen Men, Point Zero, and Sympathetic. Another useful point your practitioner can show you is the liver point. Ear seeds are often available from your acupuncturist, or they should be able to guide you to the best resource to obtain high-quality ear seeds. Once applied to your child's ears, teach your child to rub these points on the ear when feelings of stress, depression, or anxiety become apparent. Ear seeds can be left in for 3 to 5 days, can be left in during bathing or showering, and it is important to note that if they do feel sore or painful, it's totally okay to remove them from the ears. It's important to note that anxiety can affect any child. However, you can find safe, effective, and natural solutions through TCM and complementary medicine.